Welcome everybody with you Dr. Magdy Abdel, consultant of infectious diseases, hepatology and gastroenterology. Our topic today about symptoms of syphilis. So, syphilis is sexually transmitted disease caused by the bacterium Treponema pallidum. Syphilis can cause serious health effects without adequate treatment. So, syphilis case reports continue to increase since reaching historic low in 2000 and 2001. During nowadays, new cases of syphilis, all stages, appeared continuously. Gay, bisexual, and other men who have sex with men are experiencing extreme effects of syphilis. They account for 36% of all primary and secondary syphilis cases. So they also account of 447% of all male cases. However, case rates are increasing among heterosexual men and women. Congenital syphilis continue to be a concern in all Europe and United States. Congenital syphilis occurs when pregnant person passes syphilis to their baby. Syphilis spreads from person to person by direct contact with syphilitic sore known as chancre. Chancres can occur in, on, or around the penis, vagina, anus, rectum, and the lips or mouth. During vaginal, anal, or oral sex, this can spread bacterium of Treponema pallidum. Pregnant people with syphilis also can transmit the infection to their unborn child. The average time between acquisition of syphilis and the start of the first symptom is 21 days. However, this can range from 10 days to 90 days. So, what about symptoms and signs in adults? Syphilis symptoms can look like many other diseases. However, syphilis typically follows a progression of stages that can last for weeks, months, or even years. Primary stage, a single chancre marks the onset of the primary first stage of syphilis, but there may be multiple sores. The chancre is usually, but not always, firm, round, and painless. It appears at the location where syphilis enters the body. These painless chancres can occur in locations that make them difficult to notice, like vagina or anus. Chancre lasts from 3 to 6 weeks and heals regardless of whether a person received treatment. However, the infection will be progress to the secondary stage if the person with syphilis does not receive treatment. As regards the secondary stage, it includes skin rash or mucous membrane lesions, sores in the mouth, vagina, or anus, mark the second stage of symptoms. This stage typically starts with the development of a rash on one or more areas of the body. Rashes during the secondary stage can appear when the primary chancre is healing or several weeks after the chancre heals. Usually does not cause itching. The chancre after this itching, this rash usually does not cause itching, may appear as a rough red or reddish brown spots on the palm of the hand and the bottom of the feet. However, rashes with a different appearance may occur on other parts of the body. Sometimes they resemble rashes caused by other disease, maybe so faint they are hard to notice. Condyloma lata are large, raised, gray or white lesions. They may develop in warm, moist areas like the mouth, underarm, or groin region. In addition to rashes, signs and symptoms of secondary syphilis may include fever, swollen lymph nodes, sore throat, patchy hair loss, headaches, weight loss, muscle aches, fatigue. The symptoms of secondary syphilis will go away with or without treatment. However, without treatment, the infection will progress to the latent and possibly tertiary stage of the disease. Latent stage. The latent hidden stage of syphilis is a period when there are no visible signs or symptoms of syphilis. Without treatment, syphilis will remain in the body even though there are no signs of symptoms. Early latent syphilis is latent syphilis where the infection occurs within the past 12 months. Late latent syphilis is latent syphilis where infection occurs more than 1 year ago. Latent syphilis of unknown duration is when there is not enough evidence to confirm initial infection was within the previous 2 months. Latent syphilis can last for years. Tertiary syphilis is a rare and developed in the subset of untreated syphilis infections. It can appear 10 to 30 years after a person gets the infection, and it can be fatal. Tertiary syphilis can affect multiple organ systems, including the brain, nerves, eyes, heart, blood vessels, liver, bones, joints. Symptoms of tertiary syphilis vary depending on the organ system affected. Neurosyphilis, ocular syphilis, and otosyphilis. At any stage of infection, syphilis can invade the nervous system, which is called neurosyphilis, visual system, which is called ocular syphilis, auditory or vestibular system, which is called otosyphilis. These infections can cause a wide range of symptoms. Signs and symptoms of neurosyphilis can include severe headache, trouble with muscles movement, muscle weakness or paralysis. He cannot able to move certain parts of the body, numbness, and changes in the mental status. Also, personality can be changed or dementia. Thank you very much.